This video will cover the basics of HPSM's Behavioral Health Referral Form, which can be found at hpsm.org/provider/behavioral-health. HPSM providers should follow these steps before referring members for behavioral health and substance use treatment. First, assess each patient regularly for mental health and substance use issues, paying special attention to people in high-risk groups. Second, discuss your recommendation for mental health or substance use treatment with the patient. Third, assess the patient's interest in receiving a referral for an initial assessment with a mental health or substance use provider. Fourth, and finally, when a patient is ready to start behavioral health services, fill out the referral form. Fax the completed referral form to the Access Call Center at 650-596-8065. You will receive a confirmation fax. When you're ready, complete the form as fully and accurately as possible. Make sure you include demographics and members' current status. Check boxes for all services requested. In the Assessment of Needs section, please include as much information as you have available for this member. You may also attach clinical documentation, but that is optional and not required. Review the patient's level of impairment caused by mental health symptoms and select the one that is most accurate. This will help the Access Call Center team better understand how the member is functioning. Be aware, your assessment is not a final determination. The Access Call Center will determine referral pathway. Make sure you include your information at the bottom of the referral form as the referring provider. To submit, please fax the completed form to 650-596-8065. This number can also be found on the form. Please look out for a fax confirmation. Once the Access Call Center receives this form, they will screen the information for active benefit and review clinical information. They may call you or the member for more information so that they can determine the appropriate pathway for the requested services. Timelines may vary. The member will be given information on next steps. Once the member is given information on their provider, they will need to schedule and attend appointments. Now that you've successfully completed the form, here are a few things to keep in mind. Always complete the entire form. Missing information will delay members' referral to services. This form is not for psychiatric emergencies. This form is not for psychiatric inpatient discharges. Please call the Access Call Center at 800-686-0101. Please be sure to review the second page of this form for information on referral pathways. This form is not for children who need to be referred to applied behavioral analysis for treatment for autism. Please see the second page for more information. This form is not for members currently in mild to moderate treatment that need specialty mental health services or a higher level of care. This form can be found on the HPSM Provider Forms page. This form is not how you request a change of provider for a mild to moderate service. Please ask the member to call 650-616-2557 to be rematched to care. Thank you again for supporting members' connection to mental health treatment. We thank you for reminding members that with treatment and support, their mental health symptoms can improve. From the Health Plan of San Mateo, thank you for your continued commitment to our community.